Before surgery, most people worry about pain or recovery. That's what I was worried about. But one of the most important conversations you can have with your doctor is about your risk of blood clots. Blood clots like deep vein thrombosis or pulmonary embolisms can sometimes happen after surgery, which is what happened to me. Surgery temporarily creates several conditions that make clots more likely. You're moving less, your body is in an inflammatory healing state, and blood vessels can be affected during the procedure. So before you go into surgery, it can help to quickly assess your own risk factors so that you can bring them up with your doctor. You need to ask yourself, have I ever had a blood clot before? Does anyone in my family have a history of blood clots? Am I taking estrogen-based birth control or hormone therapy? Will I likely be less mobile for several days after surgery? Is my surgery expected to last more than about 2 hours? Am I pregnant or recently postpartum? Do I have cancer, autoimmune disease, or another chronic inflammatory illness? Am I planning to take a long flight or road trip within a few weeks of surgery? If 2 or more of these apply to you, or if one of them is a strong risk factor, like a previous clot or estrogen therapy, it's a really good idea to bring this up with your doctor before surgery and ask about some prevention strategies. Ask them questions like, based on my risk factors, do I need blood clot prevention medication? Will I have compression devices or compression socks during or after surgery? How soon should I start walking after surgery, and how often should I be trying to get up? Are there medications or hormones that I need to stop before my surgery? What symptoms should make me seek medical help after I go home? Because the good news is that many surgical blood clots are preventable when risk is identified ahead of time. And remember, your surgeon may know the procedure, but you know your history, and both matter when it comes to blood clots.